so I'm going to inject just a little bit of Botox right there. Right there. And that's it.
Hi, I'm Dr. Joel Kopelman, a facial plastic surgeon in New York City. I'm going to walk you through a typical consultation with some of my patients. My goal is not to alter their natural appearance, but to subtly enhance their natural features.
Hello.
Hi.
I'm Dr. Kopelman.
Sunni.
Hi, Sunni.
Nice to meet you.
Nice to meet you. So, what brings you here today?
So I'm interested in getting preventative Botox. I've heard about this thing where you can get Botox before you actually start to develop fine lines and wrinkles in order to prevent you from ever actually getting those wrinkles.
Yes.
But I don't know a lot about how it works.
Okay. So you've never had Botox before?
No.
Okay. So I'm going to explain everything to you. First of all, what do you think Botox does?
So I've always heard these like horror stories, or whenever a woman looks like she's had too much work done, like everyone's like, oh, she's got too much Botox. So I just wanted you to kind of like clear that up.
Okay. So it's true that some people do get too much Botox and they become expressionless. So our goal today is to inhibit muscle contraction. So I always look at my hand and I say, well, the skin has lines, and if I inhibit the muscle underneath the skin, it can't contract as firmly and the lines will be less prominent. Now, in your case, you really have virtually no lines.
Thanks.
So, okay.
I see it a little differently, but I appreciate that.
Okay. So, what I would recommend is that I'd like to explain how the Botox works first,
Okay.
besides the contraction of the skin. And what I like to do is get a diagram for you first. So I have a diagram right here, right next to me. And this diagram shows us that there are muscles that pull the brow up, and there's muscles that pull the brow down. And when people get too much Botox, what happens is they typically get just injections right here in the inner aspect of their eyebrow, between their eyebrows. And what it does is creates a kind of a boomerang effect. So it's very obvious that they had too much Botox when that happens. So what I recommend always is to get what I call a balanced injection in 3 different locations.
Okay.
Okay, so I never like to just inject this one spot alone, because you may end up with what's called a spot brow.
Right.
So the spot brow is like that.
Yeah, I don't want that.
You don't want that. I know what I think you want to look natural. You want it to look more vibrant.
Right. I don't want anyone to ever know that I had Botox.
Oh, okay. Okay, that's good. Because
when you look at me, I want people to be like, oh, she's very like naturally pretty. I don't want it to be like a question if I had work done or not.
Okay. That's what I aim for. That's what my philosophy is.
Okay.
There's some people who want extreme looks based on, seeing movie stars and so forth. But I think that to me, beauty is this is a treatment just to enhance your natural beauty, not to make people point out that you've had a procedure done. And we want you to look more vibrant, more natural when you finish. And I would like you to kind of smile. Excuse me, I'm moving your hair back just so you can see. Okay. So there's some, early signs of horizontal lines here. Mm-hmm. And then squint like this, go like that. Yeah. Okay. Do that again. Let's see. So all that is muscle in here. Okay. And that muscle can be treated right in here as well. And we can put a little bit up here and a little bit over here as well. So today we're going to limit our injections to here, here, and up here as well. And by injecting up here, I prevent a boomerang effect or a spot-like effect on the brow. And so we're ready, prepared to go forward. And so I'm going to inject just a little bit of Botox right there. Right there. And that's it. And I'm gonna hold it. I'm gonna hold it so you don't have any bleeding. Okay, squint. Let me see the lines. There you go. And I'm gonna put a little bit in here. Okay, and there you go. Okay, and I'm gonna inject this side. There you go. Do that again. Okay, right there. And I'll put a little bit down here. Just because there's a little bit of lines forming there, early lines. Okay, and that's it. That's the whole treatment. How was it?
Wasn't that bad. My experience was great. Dr. Kopelman explained everything that I needed to hear and really eased my concern. I feel like it was pretty painless and easy, and I would definitely come back to him.